Let me tell you the one thing that you need to ask your surgeon if you are considering a skin pinch procedure. Specifically, you need to ask your surgeon, if you're going to remove some of the skin under my eyes, what are you going to do to support the structures around it so that I don't get sagging or drooping of the lower eyelid or lower eyelid retraction? The gold standard for preventing this complication is to do something called a canthopexy or a canthoplasty at the same time as removing skin to support that support structure while you're also pulling some of the skin out. A canthopexy is a surgical step that secures that outer corner of our eyelid hammock, the lateral canthal tendon, onto the lining of the bone, or sometimes I even anchor it into the bone in order to provide maximal support, keep that tight shape at the corner of the eyelid if you are going to be removing any skin under the eyes or doing any procedure to address wrinkles under the eyes. It's like pulling the rope of the hammock tighter so that the hammock stays farther up above the ground, keeps that tautness so that when you sit on it, you're not sitting on the ground. By performing a canthopexy, the surgeon makes sure that when they remove that little bit of skin, it's not going to be strong enough to pull the laxity down of the eyelid and cause lower eyelid retraction. Think about it this way. A skin pinch is subtraction, a canthopexy is reinforcement. For most patients, the safest and most effective way to address lower eyelid wrinkles involves some combination of, if you're going to be removing skin, you have to account for the fact that that's going to pull on those support structures and address that at the same time. So this is the most critical part. How do you use this information to protect yourself? The goal here is not to make you afraid of surgery. It's to arm you with the information you need so that you can get this surgery done safely by an experienced surgeon.